You find your cat tucked behind the laundry basket, not sleeping, not grooming, just sitting very still. Her sides move a little faster than usual. Later, she steps into the litter box, squats, waits, and nothing comes out. I am Dr. Susan, and this is the kind of moment cat parents often talk themselves out of worrying about. Maybe she is tired, maybe she wants quiet, maybe the litter box can wait. But cats often do not cry, limp dramatically, or make illness obvious until the problem is already serious. A small change in hiding, breathing, appetite, or bathroom habits can be the first visible sign of an urgent problem. The question I want to keep open is this: how do you tell the difference between a harmless cat quirk and the moment you need to call the vet immediately? Before I count down the signs, I need to reframe the way you read your cat's behavior. I am Dr. Susan, and in my clinic, I see one pattern again and again. Cats hide pain until they cannot hide it anymore. So in this video, you will learn 16 signs that should trigger a call to your vet, including the most urgent emergencies that should not wait until morning. This is not meant to replace an exam, and it is not meant to make you panic. It is meant to give you a practical checklist so you know when a quiet change is actually a warning sign. Keep in mind that a cat can still walk, eat a little, or sit calmly and still be in trouble. Staying quiet is not proof that your cat is fine. More often than not, it is how cats protect themselves when they feel weak. We will move through these signs one by one, but if your cat is already struggling to breathe, unable to urinate, collapsing, or has pale, blue, or gray gums, call a vet now. And I want to start with one of the most painful emergencies I ever see because it can happen suddenly. Dragging the back legs is an immediate red flag, especially if it starts suddenly. You may see your cat fall over, cry out, pant, or try to pull themselves forward with the front legs. The back paws may feel cold, look pale, or barely move at all. One serious cause is called a saddle thrombus. In plain terms, a blood clot blocks blood flow to the back legs. This often happens in cats with hidden heart disease, and it is extremely painful. This is not something to watch overnight or test again later. If your cat cannot stand, is dragging the back legs, or seems in severe pain, call your vet or an emergency clinic immediately. The next sign can look like simple constipation, but in many cats, it is far more dangerous. If your cat keeps going to the litter box, squats, strains, cries, and little or no urine comes out, treat it as an emergency. This can mean a urinary blockage, where urine cannot pass normally. As pressure builds in the bladder, toxins can build up in the body, and the situation can become fatal within 24 to 48 hours. This is especially common and dangerous in male cats because their urethra is narrower, so even a small blockage can stop urine flow. Do not assume your cat is constipated just because they are posturing in the box. If you see repeated attempts with no urine, call your vet or an emergency clinic immediately. Now I'm going to shift from the obvious emergencies to a sign many cat parents dismiss as normal. An occasional hairball can be normal, especially in a long-haired cat, but frequent hairballs are not something I want ignored. If your cat is bringing up hairballs every week, doing it forcefully, or the episodes are getting worse, it may mean hair is not moving through the digestive tract the way it should. It can also point to excessive grooming from itchy skin, stress, fleas, or irritation. Keep in mind, a hairball should not come with appetite loss, weight change, repeated vomiting, or low energy. If those show up, call your vet. And if what you are hearing sounds less like a hairball and more like a cough, I pay very close attention. A true cough often looks different from vomiting. Your cat may crouch low, stretch the neck forward, and make repeated hacking sounds without bringing anything up. If your cat coughs repeatedly, or the cough lasts more than one day, call your vet. It could be a sign of asthma, allergies, lung disease, or sometimes a heart-related problem affecting breathing. Listen for wheezing, watch for effort, and notice if the episodes are becoming more frequent. Coughing with breathing difficulty, blue gums, or open mouth breathing is urgent and should not wait. Breathing signs matter, but the eyes can also tell me when something inside the body is wrong. Changed pupils can be an early warning sign that something is wrong. If your cat's pupils stay wide in normal light, or one pupil is larger than the other, it needs veterinary attention. Unequal pupils are never normal. They can point to eye disease, pain, high blood pressure, nerve problems, or trauma, especially if the change appears suddenly. To check safely, look at both eyes in the same lighting. Notice whether your cat is squinting, bumping into objects, hiding more, or showing redness, cloudiness, or a change in vision. Do not wait if the pupils remain different, stay dilated, or come with stumbling or unusual behavior. The eyes can show quiet trouble before your cat makes a sound. But when the problem moves from the eyes to the mouth and lungs, the clock can move much faster. Open mouth breathing is one of the clearest signs that a cat may be in urgent trouble. Cats normally breathe through the nose, so if your cat is sitting with the mouth open, panting, or pulling air in with effort, it can mean they are struggling to get enough oxygen. There are a few exceptions. A cat may briefly pant after hard play, overheating, or a sudden scare. But if it continues, happens at rest, or appears without a clear reason, call an emergency vet. You may also notice the sides heaving, the neck stretched forward, pale or blue gums, hiding, or an inability to settle. Keep your cat quiet, avoid forcing handling, and get professional help fast. Not every urgent sign is loud, though. Sometimes the warning is a cat simply disappearing. A cat that suddenly hides more than usual is not just being mysterious. If your kitty starts staying under the bed, disappearing into closets, avoiding touch, or choosing a strange place they never use, take it seriously. Cats instinctively hide weakness. Pain, illness, fever, injury, or stress may show up as distance instead of crying or obvious distress. A normal nap in a favorite quiet spot is different from refusing food, skipping the litter box, growling when approached, or not coming out for hours. Look for paired signs: appetite changes, litter box changes, vomiting, limping, or breathing changes. If hiding is sudden or unusual, call your vet. And if a hidden cat comes out walking differently, that is another sign I do not want you to sleep on. Sudden limping should always get your attention, especially if your cat refuses to put weight on one leg or starts moving in a stiff, uneven way. This can happen after a fall, a sprain, a fracture, a bite wound, an abscess, joint pain, or hidden trauma. Keep in mind that cats may still walk on an injury because they are very good at masking pain, so movement does not automatically mean the problem is mild. Call your vet faster if the limp is sudden, severe, painful, swollen, or follows a jump or fall. The next sign is one people normalize far too often because they think cats just throw up. Frequent vomiting is not something to brush off as a normal cat habit. Vomiting a few times a year can happen, but repeated vomiting is different. If your cat throws up several times in a day, vomits more than usual over a week, cannot keep food or water down, or brings up blood, call your vet. This is especially important for kittens, senior cats, and cats that seem weak or withdrawn. Repeated vomiting can quickly lead to dehydration. It can also point to poisoning, kidney or liver disease, digestive inflammation, or a blockage that stops food from moving normally. When you call, track how often it happened, what it looked like, and whether appetite or energy changed. Vomiting often connects to the next major clue I ask about in almost every exam: appetite. A sudden change in appetite is one of the most important red flags in cat health. If your cat stops eating, eats much less, or walks away from food they normally love, call your vet for advice. Loss of appetite can come from pain, dental disease, nausea, fever, kidney disease, stress, or many other illnesses. Keep in mind that cats who eat little or nothing for too long can become very ill, so do not wait several days hoping it will pass. The opposite can also be concerning. If your cat suddenly seems ravenous, begs constantly, or eats more while losing weight, it could point to diabetes, thyroid disease, or another underlying problem. Either way, appetite tells you a lot. Sometimes the first clue is not food at all. It is that your cat suddenly seems like a different cat. If your friendly cat suddenly hisses when you touch their back, or your vocal cat goes quiet for a full day, do not dismiss it as attitude. Sudden personality changes can be an early sign of pain, fever, injury, stress, or illness. Cats often compensate quietly, so behavior may change before obvious symptoms appear. You may notice hiding, unusual clinginess, restlessness, confusion, irritability, or a cat who no longer wants to be handled. While one odd moment can happen, a sudden or persistent change needs attention, especially with appetite, litter box, grooming, or movement changes. Call your vet and describe exactly what changed. And one of the most measurable behavior changes happens at the water bowl. If you are refilling the water bowl more often, finding larger urine clumps, or seeing your cat visit the litter box again and again, schedule a veterinary visit. Increased thirst can be one of the first signs of kidney disease, diabetes, or hyperthyroidism. You may also notice your cat drinking from sinks, toilets, dripping faucets, or acting like they are never fully satisfied after drinking. This may not look urgent at first because the cat may still eat and move normally, but inside the body, fluids, sugar, hormones, or kidney function may already be changing. Do not wait for collapse. Call your vet and describe the water and litter box changes. The next sign sign is easy to see with your eyes because it changes the way your cat's coat looks. A healthy cat usually keeps its coat smooth, clean, and well arranged. If your cat suddenly looks greasy, matted, flaky, or scruffy, it could mean they feel too unwell to groom. Grooming takes energy, flexibility, and comfort. Arthritis can make twisting painful. Dental pain can make licking uncomfortable. Obesity, weakness, fever, or illness can also make a cat stop caring for their coat. Keep in mind that a little seasonal shedding is normal. What is not normal is a cat who stops maintaining themselves, especially with weight change, hiding, appetite changes, or reduced movement. If this appears suddenly, book a vet check. And while you are close enough to notice the coat, there is another clue you may smell before you see it. Bad breath is not just an unpleasant cat quirk. More often than not, a strong or persistent odor from the mouth is a sign of dental disease. You may notice red gums, brown tartar, drooling, chewing on one side, or a cat who walks away from food after sniffing it. Inflamed gums, infected teeth, oral ulcers, and tooth resorption can all be painful, even when your cat still acts mostly normal. Keep in mind that untreated dental infection can spread and make eating harder over time. If the smell changes suddenly or comes with pawing at the mouth, bleeding gums, drooling, or reduced appetite, call your vet. From the mouth, I want you to zoom back out to the whole body because weight can tell a much bigger story. A small change on the scale can mean a lot for a cat. Depending on your cat's size, 1 pound can be like 10 pounds on a person. Unexplained weight loss should always be checked, even if your cat is still eating, playing, and acting normal. It could be a sign of diabetes, hyperthyroidism, kidney disease, cancer, dental pain, or another chronic illness. Weight gain matters too. It may come from overeating or less activity, but it can also mean fluid buildup, pregnancy in intact cats, or other medical changes. Keep a monthly weight record if you can. If the change is sudden, call your vet. And now we come to the sign I want every cat parent to know how to check, because it can reveal an emergency in seconds. Lift your cat's lip and look at the gums. Healthy gums are usually a soft pink, and they should feel moist, not dry or sticky. If the gums look pale, white, blue, yellow, or brick red, call your vet immediately. Pale or white gums may suggest blood loss, shock, or poor circulation. Blue gums can mean your cat is not getting enough oxygen. Yellow gums may point to liver problems or red blood cell damage. Brick red gums can happen with toxicity, overheating, or severe inflammation. You can also check capillary refill. Gently press the gum, then release. The color should return within about 2 seconds. If abnormal gums come with weakness, collapse, breathing trouble, vomiting, or trauma, treat it as an emergency. Now that you know the signs, I want to pull them together into the one rule that answers the question we started with. The real danger is not always the first symptom. It is the extra night you wait because your cat still walked to the window, still purred once, or still looked almost normal. That is why these signs fall into different levels of urgency. Breathing trouble, blocked urination, dragging back legs, abnormal gums, collapse, or severe distress mean call immediately. Appetite changes, drinking changes, vomiting, weight loss, poor grooming, coughing, behavior shifts, and eye problems still need attention soon if they persist or feel unusual. Keep in mind, you do not need to diagnose the illness at home. Your job is to notice the pattern and act. As Dr. Susan often says, I would always rather examine a healthy cat than miss a sick one. So here's the simple decision I want you to take with you when something feels off. The difference between a harmless quirk and a vet call is the pattern. If the behavior is sudden, severe, persistent, or clearly abnormal for your cat, do not wait and see for too long. Call your veterinarian and describe exactly what changed, when it started, and whether your cat is eating, drinking, breathing, urinating, and moving normally. Some signs should always be treated as urgent. Open mouth breathing, repeated trips to the litter box without urine, dragging the back legs, pale or blue gums, severe vomiting, collapse, sudden major pain, or extreme distress all need immediate help. Cats survive by hiding pain, so your best early warning system is knowing what is normal for your own cat. Before you need it, save the number for your regular vet and the nearest 24-hour emergency clinic. Tell me in the comments which signs surprised you most or what subtle change once told you your cat was not okay. Thanks for watching.